Helicobacter.pylori is a spiral-shaped, microaerophilic, gram-negative bacterium. The organism has 2 to 7 unipolar sheathed flagella which enhance its mobility through viscous solutions. H. pylori remains one of the most common human infections worldwide. The prevalence varies widely according to different geographic areas and within specific regions as well as by age and socioeconomic factors. H. pylori infection is strongly associated with peptic ulcer disease. It is also associated with mucosa-associated lymphoid tissue, MALT, lymphoma, chronic, but not acute, immune thrombocytopenic, ITP, purpura, and iron deficiency anemia that is refractory to treatment. Gastritis denotes inflammation associated with gastric mucosal injury. Gastritis is usually caused by infectious agents, e.g., H. pylori, or is immune-mediated, although in many cases the cause of the gastritis is unknown. Patients with acute H. pylori are asymptomatic or develop mild self-limited dyspeptic symptoms. Acute gastritis almost always evolves into active chronic gastritis unless the patient is treated with appropriate antibiotics. It is unclear if chronic H. pylori infection causes abdominal pain in the absence of peptic ulcer disease. However, it has been associated with functional dyspepsia. Patients with chronic H. pylori gastritis can present with complications of peptic ulcer disease or gastroduodenal complications of chronic infection including gastric atrophy, intestinal metaplasia, gastric cancer, and mucosa-associated lymphoid tissue lymphoma. The endoscopic appearance is normal in as many as 50% of patients with chronic H. pylori gastritis. Other patients may have nonspecific endoscopic features including mucosal erythema, friable gastric mucosa, and diffuse antral nodularity. H. pylori gastritis typically begins as a diffuse antral gastritis, which subsequently spreads to the gastric corpus if untreated. Changes of chronic active gastritis may be associated with or result in intestinal metaplasia, atrophy. Chronic use of proton pump inhibitors, PPIs, may facilitate proximal migration of the organisms leading to corpus gastritis. Given the variable distribution of H. pylori in the stomach, and the attenuated growth observed during treatment with PPIs, we obtain 1 to 2 biopsies from 5 different sites within the stomach: greater and lesser curvature of antrum, greater and lesser curvature of the corpus, and the incisura angularis. A definitive histopathologic diagnosis of H. pylori infection depends upon the demonstration of the typical spiral-shaped bacilli on a biopsy specimen. Immunohistochemistry may be necessary for the detection of H. pylori organisms in patients on an antibiotic, chronic PPI therapy, or with other hypochlorhydric states that predispose to gastric bacterial overgrowth. Acute inflammation disappears rapidly with treatment, but the chronic inflammation, including lymphoid follicles, can persist for years. Indications for H. pylori testing include gastric marginal zone lymphoma of mucosa-associated lymphoid tissue, MALT lymphoma. Active peptic ulcer disease or past history of peptic ulcer if cure of H. pylori infection has not been documented. Early gastric cancer. Uninvestigated dyspepsia in patients less than 60 years without alarm features. Prior to chronic treatment with nonsteroidal anti-inflammatory drugs, NSAIDs, low-dose aspirin. Unexplained iron deficiency anemia. Adults with immune thrombocytopenia. Treatment. Patients with risk factors for macrolide resistance. Quadruple therapy consists of a proton pump inhibitor, PPI, bismuth subsalicylate, and 2 antibiotics, metronidazole and tetracycline, given 4 times daily for 14 days. Patients without risk factors for macrolide resistance, triple therapy with a PPI, amoxicillin, 1 gram twice daily, and clarithromycin, 500 mg twice daily, for 14 days. Tests to confirm eradication should be performed in all patients treated for H. pylori. Eradication may be confirmed by a urea breath test, fecal antigen test, or upper endoscopy performed 4 weeks or more after completion of antibiotic therapy.